Advocates for senior citizens see the new healthcare legislation as a major challenge for seniors nationwide.
The shock that's going to come from what was already passed and signed into legislation is certainly going to impact a large number of the senior population, the older people, as it's going to impact the rest of the community, because these cuts specifically that I'm talking about are referred to on the national level as Medicaid cuts, but as you get older, over 65, you receive Medicare, which is piggybacked from the Medicaid.
John Hernandez, executive director for the nonprofit Our Roots Multicultural Center, says over 100,000 people receive MEDI-CAL benefits in Imperial County.
So these cuts are going to impact the quality of life. People are not going to get the adequate care, the adequate medical attention, or the adequate medications to survive and have a quality of life that's longer lasting. And
Hernandez says these cuts could be devastating.
so it's going to impact, the cost of medical care just by doctor visits, the cost going up, or the reduction in the reimbursement to the clinics and the hospitals. So it's going to impact the services.
Healthcare services are critical for seniors living in the area.
Some of the big four illnesses, which are diabetes, heart disease, cancer, and now dementia, are exacerbated by, not only the food, but also the air quality and the water quality, and our standard of living and lack of information to really attack those issues in our own homes and our own bodies.
Hernandez has championed the senior cause for many years, establishing senior clubs, working with local, state, and federal agencies on issues affecting seniors.
I became, a resource person, a resource and referral person. So a lot of the knowledge that I have in maneuvering my community, maneuvering the bureaucracy, because I worked in bureaucracy for 34 years and worked in education as a board member for several years, and worked with other nonprofits in helping build capacity for our community. We still have a long way to go.
Hernandez works closely with the nonprofit Comité Cívico on many issues affecting the community's quality of life and health.
The concerns around the New River, for example, the Salton Sea, and now lithium extraction conversations arose. Well, that has kept me engaged with other organizations and tried to collaborate with other organizations to this day.
Hernandez says, connect with family and friends.
I think that what we need to do as seniors is we need to look back to our friends, relatives, our children, our community, and let them know, what we're going through. Let them know what our hardships are. Let them know that, our specific needs are or aren't being met.
And very importantly, please watch your health.
Senior citizens to really pay attention to their health. If we're going to see reductions in the medical attention that we are going to be provided and paid for by the government, then we should pay attention to our own bodies and try to reduce those risks by what we consume in terms of what we eat, and pay attention to the air quality outside, and hopefully that'll help us improve the quality of life and live longer lives.
For more information, please visit ccvhealth.org.